Hello again, Dr. Talorico here to talk about part 2, fibromyalgia. If you're at this video, you probably watched the first one about what's the diagnosis of fibromyalgia and how you got to that point, and some of the things that kind of show up like fibromyalgia but are not actually fibromyalgia. So let's assume you have it, and so now we're going to talk about how you get better. So getting better with fibromyalgia, the first thing we want to do is help people to sleep and get restorative sleep. Restorative sleep is enormous for restoring normal brain function, to restore normal hormone and endocrine function, to putting your body back in its normal circadian rhythm. And what I find is a lot of my patients who have fibromyalgia have very erratic sleep schedules. They're going to bed at different times of the night. They're doing different things. They're watching a lot of TV or programs in the evening. They're ramping their brains up, and they're not allowing their body to drop into a good restorative sleep. And then they just take a medication to put down the hammer and make them sleep, which is not really the best way to do it. So we want to be aware of the fact that there's a natural ebb and flow during the night and day courses. So in the morning when you wake up, your cortisol level goes up. So that's when you have a lot of energy being liberated from storage. Okay? During the evening, your cortisol levels are supposed to go down and your melatonin levels are supposed to go up. The answer isn't just to take melatonin pills or to take a bunch of different pills. What it's supposed to happen is that your body is supposed to kind of dial down in the evening so that you can rest and get good restorative sleep. Simply taking a medication doesn't cover up for the multitude of sins that have gone on before that. So setting up an optimal situation where you can sleep is really helpful. One of the things I recommend here is taking an Epsom salt bath before bed. And the reason I recommend that is magnesium is a very natural relaxer to the body. And the change in temperature from a hot bath to a colder body, that temperature drop is exactly what melatonin does. It cools off your brain and dumps blood into the extremities to cool itself off. And that's part of the lymphatic system, and it's called the glymphatic system of the brain, where the brain actually goes and rebuilds and restores a lot of these areas at night. When you're not sleeping, you really can't do that very well. So you have to sleep. So a nice Epsom salt bath. Now, there are things I recommend in place of medications to help the restorative cycle get kicked in. It's a topic in and of itself. What I will likely do for all of these things is put together a webinar, and a webinar is just a session where I can really give a lot of information, and I can also handle questions and do feedback. The number 2 thing is restoring gastrointestinal efficiency or efficacy. And again, this can't be done with drugs. You can't just take a medication and take a suppressive medication and expect your GI tract to work the way it's supposed to. If you can't digest and assimilate the food that you eat, you can't build healthy cells. You can't get the minerals like magnesium out of the food if you can't digest it. And what I find is a lot of folks have problems with their stomach acidity not being high enough. And that sounds very contradictory because most people take acid blocking medication. But in fact, that's a major problem. That's a major GI disruptor. It causes forms of malnutrition. It causes B12 deficiency because you don't have adequate hydrochloric acid to break down your foods and stimulate an intrinsic factor, it's called. A lot of folks need enzymes, so they're not breaking down fats very well. Fats are really important because you need to have vitamin A, D, E, and K. They're all fat soluble, not to mention essential fatty acids. You need enzymes to break those down. And then here's the thing that probably most people don't know. They know when they take a serotonin reuptake inhibitor that it's supposed to help their serotonin level go up. Here's the thing. 90% of the serotonin in the body is actually manufactured in the gut. So if your gut biome, the bacteria that are normally there, the healthy bacteria, are not there, they've been wiped out with antibiotics or hormones or antihistamines or any of these medications, your body's level of serotonin goes down. So whether you're stopping it from being broke down with a reuptake inhibitor or not, you probably don't have enough. And so this is one of the major issues, is that they don't have enough serotonin, and so they're using medications to keep it elevated or artificially elevated, but there's really not enough. And that comes from here. It comes from the GI problem. So this is probably the thing most people don't really think about or don't know about when they're treating their fibromyalgia. They think if I can just take medications to keep this up, keep this elevated up, I won't be depressed or I won't have as much pain. And it's a short-sighted way of dealing with a major, more complicated issue. You can't just medicate yourself into health. The other thing is we want to restore proper motion and neural function. So we have to get the body to integrate the way it's supposed to integrate. It's supposed to move a certain way, bend a certain way, twist a certain way, and you have to do that with some specific types of exercises or some structural work. So that's really important as well. And the other thing is correcting some of the other underlying issues. So if somebody has a thyroid problem, that needs to be addressed. If they're anemic, they're diabetic, these are things that need to be addressed. And so there are nutritional things to do with all of that. And you're going to find is a lot of these things overlap. They just overlap and they create a multi-plane condition that doesn't respond to a simple remedy. So this is the frustration that people with fibromyalgia have, is that they say, well, I've tried that and it didn't work. Well, it can't work because it can't fix everything. You're the driver of the body, so there's a lot of little stops you need to make along the way, and there's a lot of different groceries you need to get in order to make healthy cells. So the main thing we have to do is we have to restore health. That's how somebody's going to get well. And so what we do is our approach is to really dive down into what is the person eating, how much sleep do they get, how much pure water do they drink each day, what medications are they on, what are the side effects of those medications, what is their hormonal status, what do their labs look like, are they anemic, do they have thyroid problems, are they diabetic. All of these different issues are important and all need to be addressed in terms of what's underlying. If a person has a thyroid problem and they're not taking thyroid medication, then and they need it, if they're very deficient, or they have Hashimoto's thyroiditis or an autoimmune disorder, that's going to cause their energy levels to be very low. And so they're going to have trouble staying awake very much, but they're also not going to have really good sleep because you need thyroid to energize all the cells. Every cell in the body has a receptor site for thyroid hormone. Every cell in the body has a receptor site for vitamin D. Every cell in the body has a receptor site for DHA. And so all these things come from a good diet, a good interaction with your environment, and other things. And a lot of the medications that folks are on, and when I see a person, normally they're taking 6 to 10 drugs. And the problem is nobody knows how somebody's going to respond to 6 to 10 drugs. It doesn't start out this way, it ends up this way. So I have a drug because I have pain. I take Lyrica, and then I take trazodone so I can sleep. And then I have gastric reflux, so I take Prilosec. And then I have problems with my blood pressure, so I'm on lisinopril. And I have all these things piled up. And each medication has its own complication. And it takes you further away from being well or being whole. And so there is hope for these folks. There's hope for these conditions, but you really have to change a lot of the things that got you there. And the main thing is just kind of wearing your body down and depleting all of your resources. So we look at these underlying conditions very thoroughly because they're important to determine how we help them the most. There are some really good things to do in terms of supplementation, but just taking more pills, even if they're supplements, isn't necessarily the answer. We have to really go back to the basics. We have to drill down to the basics in terms of, is the body getting everything it needs from its diet? Does the digestion work? Do they have proper motion? Are they sleeping? And so those are things that, it's a very complex topic, and so those are things that I would elect to cover in a more protracted length of time because each person's situation might be a little different than the other. Although in looking at all of them, there are similarities among everyone. So we're more alike than we are different, but there are differences and they need to be addressed on a case-by-case basis. So that's one of the things that I like to do is really take a look at all the labs and all the blood chemistries and see where things are, and then plot a course for a person to get well. And it's a challenging thing, but it's doable. And you know, we do have people who get their lives back. They go from not being able to work and hold a job to be able to, you know, contribute to their families and work and be upright during the day instead of just laying on the couch. We get them to start moving around. We get them to start exercising again. They think, you know, I'm never going to be able to do these things, and with the proper care and the proper treatment, they do these things again. So it's a very rewarding thing to see somebody regain their level of function again. It doesn't mean they never have pain, never have discomfort again, but in some cases, you know, it's a dramatic change, and it has a huge effect on the quality of their life. So watch the videos. I'm going to put up information periodically. I would really like to put together, you know, a good webinar. I wrote a booklet, a manual, basically a treatment manual that I use to kind of triage a fibromyalgia patient. It's about 30 pages long. It goes over all the different things that I see that are common in fibromyalgia population versus the non-fibromyalgia population, and it's a wide variety of symptomatology. It's really quite interesting, and it just goes to show that this isn't a simple musculoskeletal disorder. This is a systemic issue throughout the body, and that getting good results requires really a multifaceted approach, and not a simple, oh, here's a pill, you take this pill and you're going to be well. It's just not going to work that way. So I hope this helps. If there's questions or anything, feel free to leave them in the video. I will try to leave a link here to the first video, and I'll link one from the first video to the second video, and then that should help people be able to find things a little better. Alrighty, thanks.